Opioid and other substance abuse addiction is a growing problem here on the Suncoast, and this is further compounded by the lack of addiction counselors. ABC 7's Alex Redmond has more.
No one would help me. I'd bring him to his physician. He's just fine. He's just a teenager.
Teresa Turner says her 21-year-old son has permanent mental illness.
He was using synthetic weed, like crush packets you buy at the store.
Turner's son lives at home.
He'll always be a dependent, but he is maintaining. He cannot hold a job.
In the city of Sarasota, substance abuse repercussions are on the rise.
From July 1 till September 15th, there were 44 overdoses, several of those who did not make it. And Manatee County right now is the epicenter of overdoses, and in fact, some reports are coming out saying they may have the worst epidemic in the country.
PJ Brooks of First Step of Sarasota says people suffering addiction need care and treatment.
We need professionals to be able to serve them. We don't currently have the capacity.
But now there's a shortage of addiction counselors. Brooks explains challenges may be that the pay scale is not great.
And that's often driven by the reimbursement rates from the state, from funders, from insurance companies, that they don't value what they're expecting.
Most likely, the next wave of people who work in addiction will have gone through it themselves, either through a family member or their own crisis.
But unfortunately, a lot of times they may have a background where they maybe have had an arrest years and years ago. And now the state has much more strict expectations in terms of background screenings.
Brooks says that the majority of homeless people are driven to the streets by substance abuse. All you have to do is look around downtown Sarasota.
We are dealing with a much more extreme client population, and it's a real challenge to get people to feel comfortable, I think, with working with this population.